1992, India was home to a population of over 12 million visually impaired people. Now, experts attribute this to cataract, a condition that's easily preventable with timely intervention. This lacrimal state of Indian eye care is what drove Dr. Govindappa Venkataswamy on his mission to inspire change. I'm Menaka Doshi, and you're watching Innovation at Work. At an age when most people would be planning their retirement, one man took up the task of building an institute that would revolutionize eye care treatment in India and change the way millions see the world. Today, we take you through the genesis and growth of one of the most successful eye care hospitals in the world, Arvind Nethralaya.
It was in 1976 that Dr. Venkataswamy, or Dr. V as he's fondly known, laid the foundation stone for Arvind Eye Clinic. It started as a small 11-bed clinic that aimed at providing affordable eye care to the masses. Over time, the clinic grew remarkably. In 2007, the same year that saw Dr. V's death, the Arvind Eye Care System, as it's now called, performed a staggering 2.4 million eye examinations and 285,000 surgeries. That's more than 3 times any other specialty surgery hospital in the world.
So it's like a temple. We have brought it for 32 years, and the people have so much of faith on us. You know, every day thousands of people are coming to this. This is a paying hospital, and then we have a free hospital in adjoining, same number. And the whole Madurai is flooded with our people. If you go to the railway station, you'll see a green patch or a dark glasses everywhere in the bus stand. So the whole success story of this is the reputation of the institution, because the people trusted us.
Even with this enormous volume of patients, it's hard to believe that the hospital provides free treatment to more than 50% of its patients. Over 12 lakh patients receive subsidies on travel, stay and food.
அதனால நான் இங்கே வந்த இடத்துக்கு பாத்திரத்திலே பார்ப்போம்னு சொல்லி தான் வந்தேன்.
எவ்வளோ பணம் கட்டிருக்கு?
பணம் இப்போ கட்டலை. 100 ரூபா அந்த இது செய்கிறதுக்காண்டி, இந்த எக்ஸ்ரே எடுக்கிறதுக்காண்டி 100 ரூபா கட்டாங்க. 100 ரூபா கட்டிருக்கு.
And yet, Arvind Eye Care remains a completely self-sustaining venture without any dependence on charity or donations for any of its operations. Further, it even generates a healthy surplus each year. A surgeon at Arvind performs as much as 2,000 operations every year, as against a national average of 220. The average cost per operation thereby stands at a mere 900 rupees.
Each patient is tracked. Each result is looked in, and we do a lot of postmortem of data to find out what kind of complication rates we have. So our target for complication rates is 1%, whereas accepted levels are 2%. Even our infection rates are like 1 in 3,000 or 1 in 4,000, which is comparable to any other developed country.
சைக்கிளில் நின்று செவத்தோரன்றது சைக்கிளில் விழுந்துட்டான். அப்படியே அடித்து நெட்டுக்கும் தையல் போட்டிருக்கு மொழியில், கருப்பு மொழியில். சனிக்கிழமை ஆப்ரேஷன் பண்ணாங்க. நேற்று கொஞ்சம் மயக்க மருந்து கொடுத்து பார்த்துருக்காங்க எந்த அளவுக்கு பாதிச்சிருக்கா, நரம்புலாம் பாதிச்சிருக்கா என்னன்னு பார்த்தாங்க. சமயநல்லூர். அங்கெல்லாம் இல்லை அப்படியே.
To ensure increased accessibility, Arvind Eye Care has always strived to be community-oriented in its services and come as close to its patients as possible. Today it has 5 hospitals, 2 clinics and 3 vision centers in Tamil Nadu. This growth has been sturdily supported by its outreach strength. Apart from this, Arvind also runs managed operations of 4 hospitals in West Bengal, Gujarat and Uttar Pradesh. Vision Centers, yet another Arvind initiative, adds a new dimension to outreach.
We have used the IT to the maximum, wireless connectivity, so that video conferencing, each patient will be given consultation by the doctor, not by the ophthalmic technician. A patient needs a glass, prescribed, ground there, given glass there itself in the village. Within an hour it will be given. They need not travel to the city to get the glasses. So that is the concept, also is the first of its kind we have developed.
Arvind's manufacturing wing, Oro Labs, focuses on the manufacture of lenses and other ophthalmic consumables on a large scale. In fact, it continues to cause a marketplace disruption with its competitive prices. An example of this is that of an intraocular lens that used to cost $200 when it was set up. Oro Labs offers a product of the same standard for just $5.
We started in '92, so over the period of about 14 to 15 years, we have supplied products to close to about 120 countries.
An obvious question that emerges is perhaps if Arvind has created a system or a culture that can be replicated. The Arvind team believes there is tremendous potential for replicating its systems.
And it is very interesting that about 3 or 4 months back, I was contacted by a WHO division which is working in HIV prevention, mainly in Africa. And so now they have a program which is getting rolled out to engage in male circumcision, where you're able to achieve a throughput of, say, 50, 60 surgeries per surgeon per day, while they're struggling with 3 or 4 circumcisions per day. So we're in dialogue now, and they really want to come and study our model in its totality.
Massive scale, world-class quality, wide outreach, a self-sustained supply chain of consumables, and most importantly, a system that can be replicated. Now that's what the Arvind Eye Care system has achieved in the past 30 years. For how they did that, join us on the other side of this break. The operative philosophy behind the surgery process adopted at Arvind was inspired by a rather unlikely source. Dr. V maintained that if Roy Kroc of McDonald's could provide the same taste across the world at such a large scale, then what prevented him from standardizing the intricate process of eye surgeries across the world whilst maximizing scale?
Dr. V's compassion for the visually impaired motivated him to offer his services to the community in the field of eye care. With years of experience at the senior level in a government hospital, the Arvind Eye Clinic was a step forward to further his vision.
The initial period, we didn't have anything. We never had a vision, we never had a mission. This width of knowledge we never had, this experience we never had. We never had money, and all we had was the degree and a goodwill. So initially everything was hard, but we worked very hard for everything, you know, for money, for people, for a building, to buy a fan or equipment. We used to spend a lot of time in discussing whether we need it or not.